let's start with our panel discussion. And because you're, of course, now super keen to hear your experience and also to get to a bit deeper into the topic. And together with me in the panel today is Markus Leyck Dieken. Welcome to the panel. He is an internist and former CEO. I do it like Land style, so I'm like introducing him now. I try to do it as engaged as he's doing. Markus Leyck Dieken is an internist and former CEO of Gematik, where he played a key role in the digitalization of the German healthcare system. One of his major achievements was the significant modernization of the system through digital innovations, particularly during the COVID-19 pandemic. During this time, he led the development of modern principles of telematics infrastructure, TI 2.0, a digital healthcare platform that facilitated the introduction of e-prescriptions and electronic health records, the EPA. Prior to Gematik, he managed Novo Nordisk in the DACH region, the EU vaccine business of Novartis, and was CEO of Ratiopharm and global lead of Teva CNS business. And as we know since this week, so super hot news, he is executive partner of the Brückenköpfe. And we are happy to have you on the panel. Thanks for coming, Markus.
Thank you, Anja. Thank you very much.
Then we have Andreas Vath with us tonight. He is a partner and co-head of tech private equity at Luther Law Firm and brings extensive experience in M&A and private equity. He advises financial investors, private equity firms, strategic investors, companies, and family offices on complex national and international transactions. His focus is on the strategic advisory of companies in the healthcare, the technology, and the industrial sectors, with a strong emphasis on innovative solutions in digital transformation. Welcome, Andreas.
Thanks for having me.
Then we have Arwid Zang with us tonight. He is the CEO of Greenheads, a company specializing in preventive cybersecurity solutions, particularly AI-supported attack simulations. Before founding Greenheads, Arwid was the managing director of Arwid Security, where he gained extensive experience in white hat hacking and penetration testing for companies of all sizes in Germany and internationally. Under his leadership, Greenheads has developed innovative solutions that revolutionize security protocols, particularly in the healthcare sector. Arwid is a certified auditor of critical infrastructures, the CRITIS, and an expert witness in international cybersecurity-related court cases. Welcome, Arwid.
Thanks for having me.
And Vanessa is unfortunately sick tonight, so this is why you see my colleague Christian again in the panel, because obviously we have some overlaps here in the data area. So thanks for jumping in. As your wife is expecting at home, we hope that we manage the panel. Otherwise, you just run.
You're replacing a wife, so she should be understanding. Right?
All safe.
Wonderful. Then let's get started with the first round of questions. And we thought that we would like to start with the current situation, and we wanted to share with you as like the first round of questions, what is the current situation in Germany and the EU? And I would like to play the ball to Markus. How do you evaluate the current situation in Germany and the EU regarding the status quo of digitalization in the healthcare area? Please.
Okay, here we go. Let's position it in two ways. First of all, the things that the nation needs to fix, and then the things that the industry is doing right now. Well, we had finally a digital prescription for Germany. After a lot of resistance, we have now 420 million e-prescriptions in Germany after everybody was against it. But we are nation 18 in Europe on this. The only good thing about this is we are running up so fast that we're probably catching up with some other countries who didn't penetrate with digital prescriptions so quickly. So our penetration is quite good. We are number 18, and the only good thing is, against the resistance of many others, this is the first national tool that we have on international standards. That becomes important later on when we speak about the future, right? Because it is very debated, I know that, I come from the industry, that the industry believes you don't need any national agency. actually, in our healthcare systems in Europe, you need a common infrastructure. You need some rails where the trains go on, although the market then has different trains, right? So we do need that. And let's face it, we are still running behind. We are the only major nation in Europe that did not give a digital ID to its population. And all of you who do things in digital currently find a solution within your islands, in a hospital or in a platform or in any services. But the real game becomes very, very interesting when we all have a digital ID. Because a digital ID is what you need to identify and what we need to come easy entry, right? 43 million Italians have an ID. They can register their cars online. So I kindly ask you, if you go around in Europe, don't even believe that it's only the Swedish and the Estonians who can do it. Ask your waiter in Spain, in Italy, in Croatia, what he's doing digitally, and you will be surprised. 80% of the digital prescriptions in Croatia, since 5 years, digital prescription in Spain, right? So don't believe that the Mediterraneans are behind us. They're all advanced of us, right? And the last thing is, we have the European Health Data Space coming up. We will be the last nation together with Iceland joining these guys now. And the ball is running already. And I see someone in the back who's following up some discussions, and he knows exactly the Germans believe that Europe is waiting for us. But Europe is not waiting for us at all. Europe has the ball already in the game. It's like we're coming too late for European championships, so to say, right? And with the ball in the game, they already defined the level of security, the level of safety, the rules how we play. That's all already defined. And we're coming into the game as the last player. And we need to adjust to that, which is actually good for us because the Europeans are much more pragmatic than we are. Because our way of doing it, our way of defining GDPR, which we call DSGVO in Germany, was lately commented by the authors in Brussels to me in a Politico backstage talk. And the authors came from Belgium, from France, and from Ireland. And they had a very nice quote, which I use a lot. They said, "We were so surprised what the Germans did with GDPR. The way you interpret it is we always want to write it and rewrite it again in English. So you use other German words, so you interpret it legally differently, because what you're doing is you like it so safe, the house has no windows and no doors, right?" and that's exactly how they put it, right? And I think that's where we need to embark, because the European Health Data Space is there. And we will not be putting the windows out of the house anymore, because the Europeans love windows, you know? They want the doors and they want the windows, and we need to catch up with that. So that's what we're doing industry-wise. And otherwise, on the free industry, I'm very happy that there is a lot of innovative coming into Germany. I think the 3 steps that Daniel just showed, we can have examples of all of them already. Radiology AI, pathology cuts that already are on level 3 analyzed by AI. We now have the first software systems introduced by 2 companies in Europe that will accompany the doctor with AI. It may be very basic still, but it is coming. And what we then need is that these 2 systems come together, embrace each other, because my AI system that I have in the clinic or in my practice can only be as good as my knowledge of the nation is, right? And that is where we need to start. Remember, and I'm ready in 10 seconds, when we started the pandemic, there was this news show that said, according to Johns Hopkins University, so many corona cases in Germany. Remember that? Because RKI was counting the faxes and they needed 9 days in the pandemia, right? So now we have that fixed, schematic fix that actually all of your diseases that are reportable are now in an electronic system from all the system in Germany, right? So now whether you have Gelbfieber or Trippe or Gonorrhoe, we know it, right? And we report on that. And that is what we need, because when these 2 systems come together, the pleasure of the beauty of the project is only when the data are backing you up in your practice. When someone says, those lab results look like a very seldom disease that you will once see in your lifetime. But currently, kids who have a seldom disease wait 7 years until they're diagnosed.
Thank you very much, Markus. Let's pass the ball directly as you were like finishing with the point of data to Chris. How do you evaluate the current situation? Which role does data play in the digitalization?
Yeah, I think in general, it's of course super important. There's no digitalization without data and vice versa. So it's a core element. And I think in the data part, we typically see 3 elements that you touched on. there's the collection of data, that you actually collect different data points across the industry, across the value chain, from different touch points with the patients and the individuals. The second is making that data available. So even if it sits somewhere on your cell phone, on your smartphone, or individual practice systems, how do you make it available for usage? How do you centralize it? What's that layer in between? And then actually only the third case is then making use of the data. So the data activation is what we call it. And that then is the business-oriented part that I touched on with those business use cases, right? So all three things have to work together. And the essence of it is really that it should be use case, business, and health-driven, so from the top down. But you also can't deal without the underlying architecture and availability of the data. So it all really needs to meld together. And hence, really, there are different stati today in terms of maturity, on the one hand of what's feasible in Germany in general, but of course also what individual companies make out of the data, because you don't just have your patient and health data, you also have other data points across the journey of your patients, touch points online, in appointment making, etc. So also there it's about collection and storage and availability of data and then making the most use of that. And we see the more advanced companies doing that very well and going quickly into it and then going into more sophisticated use cases beyond just data transparency and data-driven decision-making and more into AI and model-based solutions there. And I think that's the way to go to push on the general industry-wide application of standards and availability of the data, but also to make sure to give it the respective business use case angle, because without that, if you don't activate the data, there will be no value in it. And that's, I think, the other core message to bring that together.
Thank you. And when we speak about data, we always know, of course, in the healthcare environment, data is also sensitive data in that sense. And this is when cybersecurity voices become louder and louder. So Arwid, how do you evaluate it from a cybersecurity perspective? And can you also share some mistakes from your daily work that every one of us should avoid from tomorrow on?
Yeah, I can actually do that. And I can share some mistakes that should have been avoided for the last 5-10 years. So we should start tomorrow, but we could have been starting all the way back then. So as a matter of fact, we just did white hacking, so attack simulations for 3 health companies in the last 4 weeks. 2 of them were big hospitals, critical infrastructure, and one was a medical service center with 130 locations in Germany, Austria, and Switzerland. And I brought something, or better, someone to you today, my CTO, who led 2 of these projects. You can spot the white hacker because he's the only person with his sunglasses still on. He's sitting So if you have some questions about how the hackings are done technically, he's your guy later on.
He looks like a man in black, right?
Yeah.
But it's the white hacker, right?
Just like that. But back to the question. What we saw the last past years is that it's pretty easy to hack most of these companies, and the reason most of the times is a little bit abstract, but I will try to make it easy. Right now, in cybersecurity, you have the prevention. So you want the attack stopped before it can happen, before an incident can happen. You have the detection, everything you do on a daily basis, and the reaction as a third part. And what everybody is doing right now, everybody is focusing on the reaction. So as you said, it's a question of when will I be hacked? And this goes into my mindset, and I say, okay, I will be hacked anyway, so I try to keep the damage low when it happened. But you told us about the numbers. We are not really good at that. So what everyone is doing right now is we're buying a lot of software and products and not solutions. What I mean by that is, imagine you have your IT department. And yesterday you said, let's buy a firewall. Everyone knows what a firewall is. You give this firewall into your IT department and say, okay, you have to administer it. Today you buy a security operations center. Tomorrow a security incident and event management center. Then endpoint security. Maybe a vulnerability scanner to scan the whole system. And the IT department gets everything on their desk. And they are just not able to do it. And most of the cases, especially in healthcare, these guys are no cybersecurity experts at all. They are IT. So what happens then is that they are overwhelmed, and people like us, or the bad guys too, we exploit the mistakes that they do. An easy example is last week, everyone was focusing, and they knew we would attack them, so they sat in front of their desktops while Paul and one of his mates broke into the server room at night and managed to take down the hospital in less than 1 hour. So completely wrong focus. This is the one big problem with that, because these people are not offered solutions, services, where someone is taking pressure away from them, but we are doing it on top of that. And this is another problem. A second problem with that is that if a vulnerability comes out today, the big providers from software solutions and everything, they need up to a week to implement it into their scanners, for example. So even if you are top-notch, you have everything done, your homework done, and you have the perfect cybersecurity team back in your office, and there's a new vulnerability today, you will need up to 1 week until it's fixed. And this week is what prevention, what white hackers, white hacking as a service, what people in industry offer on a daily basis to close that gap and make customer secure today. And right now, only few companies, especially in healthcare, are doing that.
It's very interesting. Thank you. I still remember the case where you said that someone from the C-level opened the server room in one case because you were like going into the building and you said, "Oh, we are like maintaining the server. Can you please open the room?" And he was like, "Yeah, sure."
Yeah, that happened too. But I try to be the good guy today. I will take it easy. But if you come to me later, I have a lot of really interesting
dark stories.
But you didn't wear the dark glasses on that day, right?
No, that wasn't necessary.
Thanks, Arwid. Andreas, you're more coming from the evaluation point of view. How do you evaluate companies? What do you see? How they are really good positions? What role does data, technology? How would you evaluate it?
So we see a very broad mix. Some companies are positioned really strongly, and other companies have, I was going to say weaknesses, but maybe we should call it areas of development. So, but actually it's weaknesses. So what makes a top player top? I think, and you perfectly built the bridge, a top player would always have a very proactive approach. You would anticipate changes, embrace changes, and adopt the concepts. And that's key because the legal and regulatory environment is changing rapidly. So you need to adapt quickly. So a great company has a great governance structure and a great compliance structure. And the compliance structure is great when it's tailored to the specifics of the company. So it must be a concept that ensures compliance with our laws and regulations, but it must under no circumstances limit or restrict the company's operations. So a good compliance concept must support business and operations. Another key point is certainly the effective use of AI. So it's not just enough to say we have AI. You need to demonstrate to attract investors that you're actually leveraging it, that you're aggressively driving growth, and that you are promoting patient outcome. So that's key. And another thing is certainly risk management, cybersecurity, because it's not just best practices to have a good cybersecurity concept. It's about building trust with investors, patients, and customers, because at the end of the day, you want the data. So AI is nothing without data. I mean, everyone would certainly agree with that. So you need to create an atmosphere of trust that encourages customers and patients to share the data with you. So that's pretty much it.
Yeah, thank you very much. As Markus, you already explained how the current situation can be evaluated. Can we in the next round look a bit into like the future, how companies can become future ready and what we have to expect 2025 and the years after that?
Yeah, we're very pragmatic. So 2025, we will see in the first quarter the electronic health record coming. I know there is a lot of skepticism about it, but remind yourself, it will be the structured medication of all the German population. And coming from Ratiopharm, I can tell you, there will be a lot of data, because what we will do in the nation, we will do what in Germany we would call Deutschland macht den Pillendose-Check. And we will do it on an individual level, because we will tell you whether you have an overdosage of things, whether you have maybe too many tablets. My mother is 87. I took 2 of this medication out of her program lately. We will have interaction analysis, security and safety, because 40,000 patients per year come into a hospital in Germany due to drug-drug interaction. Then we do regional analysis. The sick funds, the payers will do analysis, and the nation will do analysis, right? And then the next year, the Electronic Health Record of Germany will already introduce the lab, 500 most used lab results as structured data. And this is where the game that all these colleagues here alluded to on the data are the necessity. For the first time, we will have them. I mean, lab results is not everything about a man, but it's a lot. It tells a lot about our life. And we will have those 500, almost everything, in structured data fields. And that's where the so-called National Research Center will start. And you all who do research can work on. They will also be the first time of a dialogue, because all the apps that you invent have the right to interact with the electronic health record. And depending on their aim, they are also the right to read the data out of the electronic health record, right? So the dimension of the products will upscale very, very fast in 2026, right? And then the European health data space provides us with a promise, which is amazing. It says a European can deliver its digital prescription in any country of the European Union. We haven't heard of that, but the Portuguese do it already with 3 nations. Last month, a Portuguese friend of mine had in Helsinki his prescription delivered, right? We can currently not even do it to Austria, right? Same language, same medication, right? Because there's a lot of tricks, obviously. The medication that exists in Portugal's pharmacies doesn't even exist to the exact same things in Finland, right? So you need to do a lot of things there. And the second thing is our so-called International Patient Summary, which is a condensed summary of our electronic health record, has the right to be read in all the clinics of the European Union in 2027, right? And we're working on this very fast. And again, that's going to be a data pool of immense amount. And the third thing is, until now, and that alludes to what Daniel said before, the cancer registries in Germany are 15 separated cancer registries who don't dialogue with each other. Actually, our interoperability council found out that there's 16 different ways of only coding your birth date. 16 different, and they all use them, right? So now there is a conversion of that register of cancer into a national cancer registry. And this is where we start being a nation that really can identify its own analysis, and all the products that then rely on that will have a much more impactful dimension to them. I think it's a wonderful outlook. And that is, again, as I said in my first answer, comes from the fact that the Europeans actually guide us and force us through this. Some of the latest law that the Ministry of Health had to deliver was not by their own will. It's actually sometimes against the belief of social democrats. But the European standard forced them to put it into the law against their own belief, because they knew that the Europeans would not accept another ruling. So it's actually very helpful that Europe is out there as a promise, because they basically steer the boat of our nation into the right waters. And it will be wonderful when now the infrastructure of TE 2.0 will be modernized. If that will happen also in the next 2 years, together with the data gathering be really on structured data, then all of the people who do products that are based on these data will have a completely new game to be playing. And I think that's quite a good outlook for all of these. That's why I also believe it's so important, because the structured data need then to be, there are pooled data, right? And there, I don't want someone to walk in the server room. So
Yeah.
I want to walk.
Yeah, everybody wants to walk in the server, right? Yeah.
And it's a good bridge actually to the next question to Chris, because you also said in your impulse that building the organization, making the organization ready when it comes to profiles and processes is also something that the top management needs to consider. Can you please elaborate a bit on this, how they can become future ready with regards to process and profiles?
Yeah, absolutely. I think what I touched on already is the 3 pillars of the data collection, the availability and the usage and activation of the data. And obviously that's an interdisciplinary topic, right? So it's really about what I mentioned before, the business use cases, but also the tech and data enablement. And I think there, in general, should be a similar logic from what we heard on the German state level. We need the same logic also on the individual company level, right? So making data available is more a tech element. And then activating the data and using it for specific use cases is really much a business topic. So what needs to be done in the future to make that merge together is having a little bit like translator profiles realistically, right? Because typically in organizations today, you have silos, you have sales, you have research, you have marketing, you have finance, you have HR, and you have IT and tech and data specialists, right? And they all sit in their individual rooms, different levels on your floors in your corporate headquarters. And they don't talk the same language, and that's the problem. But for the real value creation, they need to come together to make the most of it. Yeah? The business side needs to give requirements to the tech and data side, and the tech and data side needs to enable the business for their value creation. So I believe the core profile is really bridging this gap, and for that, you need the respective profiles that can sit in the middle and speak both of those languages. Yeah? And in line with that, you would then also instill a little bit this education part, which is not so much an AI or a tech topic or something more business oriented, but actually at the convergence space. And we see it also in different, more agile teams, that the multidisciplinary team is really the way to go, right? To bring the stakeholders together and then have the best of these elements. And I think that's also how to consider. I think there's no best solution that you could just adopt, but it's more about how is the situation today in your respective companies, and how can you overcome those with different types of setups, organizationally, project, team-wise, or different other structures that really go in that direction.
Thank you very much. And as we also heard a lot about AI, Arwid, now building the bridge from AI to cybersecurity, can you give us a bit more insights in how you would evaluate it with regards to the sensitive data, especially in the healthcare environment? How can we make the best use of AI and still be safe and protected?
Yes. Now everyone probably expects me to totally bash AI because I'm the cybersecurity guy, but it's not like that. At first, for us, from a cybersecurity point of view, not the compliance point of view, just the cybersecurity point of view, AI is just another tool. You might have heard that. But it's a tool you interact with. And whenever there's interaction, there may be possible ways to attack those interactions. So as a good example, if I want to hack your company and I want to encrypt you and make money out of it, I don't care at all whether you use AI or not. I just don't care. It's not really important here. But in one of these three cases I mentioned in the first answer, we were at a hospital and again hacked software from a third-party supplier. And this software is used by more than 200 hospitals worldwide. And it's all about data of patients. And just imagine if we as hackers then not encrypted this stuff, but we just manipulated the data. And as we heard, AI is all about data. So if we manipulate this data and 200 hospitals start using AI with fake data, the possible outcomes that are this huge. So what you have to do, I think right now everyone is doing it, but we need to take care that we do it in the future too, is to fact check whatever the AI gives out. It doesn't matter if I ask how will be the weather tomorrow, maybe, but if I really work with patient data, it's really necessary that someone looks up in the end and says, okay, this is was the data integer? Integrity of data is the big keyword here or not? But this was the negative part. There's a positive part as well. And for example, in the last years, a lot of cybersecurity measures were only affordable for huge tech companies. For example, if you want to have penetration tests of the external infrastructure, as I said in the first answer, on a daily basis, for example, that's really expensive. And right now with AI and companies like ours who use AI to have one hacker who gives his knowledge into the AI and now is able to hack 3,000 systems a day and not just 3. This model becomes scalable. Yeah, the black hat hackers do that too. It's a real problem, but I wanted to focus on the good side now. So what companies like ours are capable now is we can start scaling the measures, the proactive measures. In the past, they were only really affordable for huge companies. And right now, especially in the healthcare sector, it's a game changer because we are able to scan the whole external attack surface management on a daily basis and say, we can secure you before something happens. Mm-hmm. And that's something good.
Yeah, agreed. Thank you very much. And Andreas, looking at the evaluation of companies on AI and cybersecurity, do you see a need for due diligence in the area of AI and cybersecurity when we speak about the healthcare environment? And what's your experience on that when it comes to an exit scenario?
Wow, okay. Well, first, I mean, AI has a great impact on valuation. So generally speaking, that's because if you use AI efficiently and effectively, you leverage operations and you create growth. And that's what private equity is basically about. You want to create growth and you want to demonstrate innovation. So that's key. And so how translates that into legal work? So we would always look into the value drivers. So we would certainly dive into cybersecurity and certainly into AI. So the thing is, it has become more complex. So we do have dedicated teams with special knowledge who are certainly great when it comes to the standard evaluation, and they can dive deeply into it. But when it comes to very specific issues or matters, we would always, I'm not saying that because I'm here with OMMAX, but we would always partner with experts, because that makes perfect sense to gain additional insights from external experts. And that's key when it comes to an exit scenario, because you want to demonstrate that your data is safe, safeguarded, protected, that you are effectively using AI. And you would typically do that through dedicated internal teams, dedicated external teams, and through audits, so that you can illustrate and showcase that, and that would certainly attract investors and increase the value.
Very good. Thank you very much. Then let's do our last round of questions. With regards to the outlook in the future, Markus, I would play the ball to you again. Do you have a specific recommendation for the audience? How can they position themselves to be future ready?
First, in medicine, the thing is, usually medicine is used to bring a spotless product. In digital, I think it's very important to keep it a minimal viable product and still be daring to launch it, which is against the mentality of many sponsoring companies, because the biotech company and we cannot launch a product that is not pixel clear, right? Yeah. And the pixel clearness doesn't have to be applied into the digital product. The second thing is, please use international standard in programming. Coming from Gematik, I'm very surprised to see that, for instance, from the 51st launched DGAS, about 17 were programmed in completely proprietary standards, which means they will never be able to fruitfully really dialogue with anybody, not even talking about going European, right? So please use international standards, right? And the third thing is, don't underestimate the clearness of your data that we need, but also bring in another factor of human, which is the paradigm breaking in healthcare does never come from AI. If you believe that ulcers are created by psychological stress, which was the way I was taught in medical school, right? Then you cut away 2/3 of your stomach because you believe that's the only cure. And that was the cure until 1986. I was studying medicine at a time when the mass operational theaters were filled with people taking away 2/3 of their stomach because ulcers come from stress. Until an Australian couple said, there is a bacteria that can survive in this acidity of the stomach. And then they went to the public and said, this bacteria causes the ulcer. And in health, in science, it's very important to know that. Science said, no, we don't believe. The bacteria was invented in 1983, discovered. It was only 6 years later that they accepted it. Why? Because the two Australians swallowed the bacteria themselves and made it very clear to everybody that that is the case. So it was recognized in 1987, and the Nobel Prize was given in 2006, right? And that is, again, an element that AI bring not in, right? I just want to make sure that I want to briefly talk about the limitations of AI. You need a human factor if you have a product that is healthcare-oriented to really go and break the paradigm. And the third thing is, AI is here to make our lives better. That's the aim. But if at the same time in Germany, a population closes the eyes to science. That's terrible. I don't know if you heard about this. We have the first 5 cases of diphtheria in Germany again after, I think, more than 80 years. Diphtheria. One of my colleagues, she works at Herzzentrum Berlin. You know how long they resuscitated the 10-year-old boy that is in the papers now? 10 hours. They resuscitated, ECMO, 10 hours, a 10-year-old boy whose mother was an anthroposophic woman who said, we're not vaccinating. We have to go through this, right? So we need to make sure that we open up our eyes, that AI needs to be able to take along this population and say, this is clear, because otherwise we will have these elements that are completely, or we have two-step societies. We have a society of knowledge and society of disbelief, so to say, right? Which is not very important. So briefly, please, minimal viable product, international standards, and bring in someone who really brings in another inspiration to break the paradigms, because otherwise AI will be self-referencing itself, maybe perpetually too long.
Thank you very much. Thanks, Markus. Also, Chris, from your end, your specific recommendation on how to be future ready.
Yeah, so picking up from my earlier session, I think this getting started is super important. It's in line with the MVP logic, really start small and then iterate. I think this is super beneficial, and I want to underline that again. The other core message that I want to bring across is that you have to make AI a real management and business topic. It's not a niche something that is driven from your tech or IT department, but it should be center stage management agenda, and then it can become a success. Yeah, we had a really good comparison in one of our last conferences where it was discussed to treat it a bit similarly, like HR or finance. You have your finance team, you have a HR team, but who's doing the real recruiting and who's responsible for your financials? It's the management team. They make the decisions. They really lead it top down. And the same should be true for everything around AI, and similarly for cybersecurity. Then it will become a success. Otherwise, you can't really park it on some specialist team. Yeah, I think this is super important. And the second idea I want to give along to you guys to make it successful in the future.
Thank you very much, Arwid, from the cybersecurity perspective.
Jump right onto this because I had this slightly uncomfortable truth in the end. You have to start caring about cybersecurity. And everyone I am talking to is like, yeah, I already care. And I bought some solutions and I got this paper and I have the stamp. It shows I'm caring. And as soon as you go into these companies and find some critical vulnerabilities, it's not all of the time, but I'm just want to prove some point here. Especially in the healthcare sector, it's often like you find out you find some critical vulnerabilities and you show them to the IT department, and the IT department says, "Okay, let's burn this document. Let's not show it to the C-level." And we're like, "Yeah, why? Why shouldn't we show this to the C-level? It's their company." And they say, "Yeah, they don't want to know because as soon as they know, they have to do something.
They have to act on it. Yeah.
They have to act.
Operational excellence."
Yeah, and the C-level is like, "Okay, as long as I don't know, I don't have to act." And right now, especially, I think the lawyer will back me up here, but especially with NIS2 and everything coming around, it's more like the C-level has to care. They must know what could be potential risks and how to avoid them. So right now, you really start, caring. And as long as you do, I think I already pointed out twice how you should, scan your attack surface. But one last point that's really a really important point to me. And you did this with the audience in the beginning. I will do it in the end. Please raise your hand, everyone who is already having some awareness training inside their own company. Yeah, I expected that everyone raised their hand. So everyone who did not raise their hand yet, you really should do that. And now, please raise hands. Who has some special awareness training just for the IT department? Because IT professionals are not cybersecurity professionals. Okay, everyone who's not raising their hand right now, we should talk afterwards. Because I always hear this: the employees are the weakest link in the security chain.
That's true.
And if you say that, then you must agree on the IT department is the most important link in the security chain. So you really should train them. So that's it from me. You can start tomorrow. That's what.
Yeah. Thanks. Andreas, you're having.
I also think it's about the points that we already touched. So it's the proactive approach again. So that translates into monitoring changes constantly and training staff to be aware and to be in the position to act and not just to react. So second point is a great balance between compliance and effectively supporting operational excellence, which also means you have to adapt and change the concept. I mean, sometimes from work as a lawyer, I see concepts that are great on paper. I think, well, that's it. Just take that. But it doesn't work in practice. So you would always need to ask yourself, does it actually work? Is it effective? And if it's not, change it. So next point would be risk management in terms of cybersecurity, because again, it's about creating an atmosphere of trust. And what's important here, I think, is to have a direct and simple communication. So being transparent creates a great atmosphere of trust. So I think that's key. And finally, partnering with experts and have dedicated external teams, because that also creates trust and would attract investors. If it's a neutral auditor, that would have a bit more value. So you need to do that from time to time. And so when I say from time to time, I would say at least once, maybe twice a year. So that would certainly create a great atmosphere of trust.